Welcome to MaxLife Man, your essential YouTube channel, expertly led by our top expert, Dr. Sterling Thorne. Dr. Thorne and his top team from the prestigious Evergreen Peaks Institute bring years of dedicated research and hands-on experience in men's health. We deliver insightful, heartfelt podcasts designed to optimize your health and unlock your best self. Now let's be real for a second. No fluff. No judgment. Just one question most men never ask out loud. At my age, should I still be masturbating? Some say it keeps the pipes clear. Others whisper it drains your strength, lowers testosterone, and messes with your mind. And if you've ever Googled it at 2 a.m. with a quiet house and a louder mind, you're not alone. We've heard it all, from swollen prostate fears to men wondering why their libido is down even though they are staying active. Today, we break the silence, because here's the truth most doctors won't say unless you beg for it in a back room after your checkup. What you do behind closed doors still affects your prostate, your testosterone, your erections, and your energy. But don't worry, we're not here to shame or scold. We're here to give you science, strategy, and simple clarity. And real quick, before we dive in, if you're the kind of man who wants vitality after 60, who believes aging doesn't mean giving up intimacy, then hit that like button, not for me, but because every click tells the YouTube algorithm that senior men's health deserves to be seen, heard, and respected. And leave a quick comment. 1 if you've ever wondered about this. 0 if you think it's still taboo. Let's see who's out there thinking like you. Now, let's talk about what actually happens to the prostate when a man keeps this daily habit, and why some men feel more alive after doing it, while others feel more drained. Understanding your prostate, the overlooked engine, when most men think about their heart, their brain, even their liver, they respect them. They check them, monitor them, but the prostate? They don't even think about it until something starts going wrong. The truth is your prostate is one of the most overlooked, misunderstood, and underestimated parts of your body. It's not big. It's not showy. But it is mighty. It sits right below your bladder, about the size of a walnut. But that little walnut controls a massive part of your reproductive system. It surrounds your urethra, the same tube that carries both urine and semen. So anytime it swells, even a little, your whole plumbing system feels it. And as men age, swelling is not the exception, it's the norm. Most men over 60 are dealing with something called benign prostatic hyperplasia, or BPH. It's not cancer. It's not deadly. But it is a major reason why men start peeing more often at night, feel a weak stream, or sense they are never fully done. And here's where it connects back to today's topic, because one of the many factors that can impact your prostate's health, for better or worse, is how often you ejaculate. Too little, it stagnates, builds pressure. Too much, some believe it could increase inflammation, especially if the prostate is already irritated. But we're not jumping to conclusions yet. We'll get into that in just a moment. For now, what you need to understand is this: your prostate is not just a passive passenger. It's an engine. And just like any engine, it needs the right balance of pressure, rest, and regular firing to function at its best. You wouldn't ignore your car's oil changes, would you? So why ignore the one organ that can affect your urination, your erection, your energy, and even your sleep? No fear-mongering here, just facts. And the fact is, when you understand your prostate, you understand how to preserve your manhood. Because protecting it starts with knowing it. How aging affects the prostate, Dr. Thorne. That's how the comment started. I never thought much about my prostate until I turned 65. Then suddenly I'm up 3 times a night to pee and I feel like I'm never done. Is this just part of getting old? Jim, 68, thank you for your honesty. And here's my answer: yes and no. Yes, in the sense that this is common. No, in the sense that it's not something you should just accept and live with like it's your new normal. Let me explain. As men age, the prostate doesn't just sit still and behave. It grows, slowly, quietly, but surely. This is called benign prostatic hyperplasia, or BPH. By age 60, more than half of all men have it. By age 85, it's close to 90%. Now, here's where things get tricky. when the prostate grows. It presses against the urethra, the channel where urine flows. Think of it like stepping on a garden hose. The pressure builds, the flow weakens. That's why you feel like your stream isn't what it used to be. That's why you dribble. That's why you feel like you need to go again, even when your bladder is nearly empty. But it's not just annoying. According to Cleveland Clinic, prolonged urinary retention caused by an enlarged prostate can lead to bladder damage, infections, kidney strain, and even incontinence if left unchecked. Now combine that with something else. As testosterone dips, which it naturally does as we age, the balance between testosterone and estrogen shifts. Yes, you heard that right. Men have estrogen too, and when that balance tips, estrogen dominance can stimulate even more prostate growth. Double trouble. Here's the kicker. Some men's prostates grow rapidly, others barely at all. And while genetics play a role, lifestyle, inflammation, and yes, even ejaculation habits can influence the outcome. It's not about fear, it's about awareness. Jim and every man watching this, if your stream's weaker, your nights are restless, and your urge to go is stronger than ever, you're not crazy. You're not weak. You're not alone. You're just dealing with a prostate that's aging. But aging isn't surrender. It's just a different stage. And today we're learning how to live in it, not suffer through it. Ejaculation and the hidden flush cycle. I got a letter last week. It wasn't from a patient. It wasn't even from a man. It was from a woman named Ruth. Her husband, Carl, is 72. She wrote, "Dr. Thorne, I know this might sound strange, but I'm worried. My husband hasn't released in over 5 months. He says he doesn't feel the urge anymore. He thinks maybe it's just age, but I see the restlessness. I hear the sighs at night. I'm just wondering, does it matter if a man stops ejaculating altogether, or is that just normal after 70? Ruth, thank you. That's not just a brave question. It's a loving one. Let's talk about the hidden flush cycle. See, the male reproductive system isn't just designed for sex. It's also a transport system, one that stores, moves, and clears out fluid. Seminal fluid, prostate fluid, dead sperm cells, residual white blood cells, metabolic byproducts, they all accumulate. And if there's no regular flush, it stagnates. And in some men, that stagnation can cause discomfort, inflammation, even trigger a flare-up in those prone to chronic prostatitis. This isn't just anecdotal. According to a 2021 review in the World Journal of Men's Health, regular ejaculation has been associated with lower rates of chronic pelvic pain syndrome and improved prostate function, particularly in aging men with enlarged prostates. But here's the key word. Regular doesn't mean constant. It means balanced. For some men, that might mean once a week. For others, once every 10-14 days is enough to maintain comfort without feeling drained. The flush matters not just for physical reasons, but for emotional clarity too. Carl may think he doesn't need it, but his body might disagree, not out of lust or habit, but simply for physiological hygiene. Think of it like clearing leaves from a rain gutter. It's not sexy, it's not romantic, but if you leave it too long, you get overflow, pressure, and eventually damage. Men don't talk about this. Most doctors don't bring it up, but it matters. Ruth, tell Carl this. His silence doesn't mean he's weak. His confusion doesn't mean he's broken. It just means his body has shifted and his strategy must shift too. He doesn't need to return to the man he was at 30. He just needs to learn the rhythm of his body at 70 and honor it. The shocking truth from Harvard, let me take you back to 2016. That year, researchers at Harvard T.H. Chan School of Public Health dropped a bombshell, not with a headline, but with a number, 21. That's how many times per month a man needed to ejaculate to experience the benefit they uncovered. And what was that benefit? A 33% lower risk of developing prostate cancer compared to men who ejaculated only 4 to 7 times per month. Let me say that again. 1/3 lower risk. The study followed over 31,000 men for 18 years, not 18 weeks, not 18 months. This wasn't guesswork. It was one of the largest, longest studies ever done on male sexual health. The conclusion was simple. Men who ejaculated more frequently had fewer prostate problems, less inflammation, and significantly lower risk of malignancy. Now, before you rush to schedule your way to 21 times a month, let me clarify something. The number isn't magic. It's a marker, an indicator of healthy function, blood flow, hormonal activity, and internal rhythm. It doesn't mean quantity equals safety. It means stagnation equals risk. The prostate, when inactive, becomes vulnerable. Just like a stagnant pond breeds bacteria, a stagnant prostate may invite inflammation, congestion, and over time, cell mutation. And this isn't about sex. In the Harvard study, ejaculation didn't need to involve intercourse. It could be alone with a partner even during sleep. The body doesn't judge, it just counts. Now here's where it gets even more interesting. The researchers weren't looking for this outcome. They were studying general male health. But this pattern kept showing up over and over again, and that's what makes it powerful, because when a result surprises even the scientists, that's when we need to pay close attention. So the next time someone tells you that's not important anymore, or you're too old for that now, just remember what the data says. Your body hasn't given up on you. Maybe you've just given up on the conversation. But now you know the truth is out there, and it's a whole lot more hopeful than you've been led to believe. The flush-out theory, how it really works all right. Let me ask you something real quick. What do you think happens to the inside of your body when you don't release anything for 3 months straight? No, really, pause for a second. Imagine any other system in your body that stores fluid, creates pressure, and requires regular clearance. Your sinuses, you blow them, your bladder, you empty it, your bowels, hopefully daily. So here's the uncomfortable question most men never ask. Why do we expect the prostate to be any different? There's this theory not in textbooks, but in real-life urology clinics called the flush-out effect. And no, it doesn't mean more is always better. But it does mean that occasional release helps clear out old fluids, dead cells, inflammatory compounds, and keeps the pipes flowing. In fact, the European Urology Association noted in a 2020 consensus paper that seminal vesicle emptying plays a role in reducing pelvic congestion symptoms in older males. Translation: clearing the tank may reduce discomfort, especially in men with BPH or low-grade prostatitis. But now let's flip it to you. Have you ever gone weeks without releasing and then suddenly felt off? Low energy, foggy head, a little more irritable than usual, could be coincidence, or could be a backup in the system, you tell me. Drop a quick comment. 1 if you've ever noticed that post-release clarity. 0 if you think it's just nonsense. No judgment either way. I read the comments. I learn from them too. And hey, if this kind of conversation makes sense to you, if it feels like finally someone is talking about what's really happening behind the scenes in a man's body after 60, then hit that subscribe button. Not because we're chasing numbers, but because I promise you this. No one else is saying these things. Not like this. Not with this kind of respect for your intelligence, your dignity, and your manhood. We're just warming up. Because now that you understand the logic of the flush, you need to know what happens when that flush changes something else entirely, your sleep. Can ejaculation ease nighttime urination? Here's a reality many men live with, but almost no one talks about. The 2:00 a.m. wake up, then 3:30, then 5:00. You shuffle to the bathroom, half asleep. You stand there longer than you should. And afterward, you wonder, why didn't it feel like a full release? This pattern, nocturia or nighttime urination, is one of the most common complaints among men over 60, and one of the least connected to what's really going on. Let me explain. When your prostate enlarges, it doesn't just affect the size of your stream. It changes the pressure around your urethra, the urgency signal your bladder sends, and the way your pelvic floor relaxes. That means even if there's not much urine in the tank, your body still thinks it's time to go. Now, here's where ejaculation enters the picture, not as a solution, but as a variable in the equation. During ejaculation, the prostate contracts. It squeezes, empties, And more importantly, it helps decongest the surrounding structures. There's evidence, like a 2019 clinical update in Therapeutic Advances in Urology, showing that ejaculatory activity may relieve pelvic pressure and reduce irritative urinary symptoms in men with chronic prostate conditions. In other words, when the system flows regularly, the pressure buildup that triggers nighttime urgency may ease. It's not a cure, but it's a form of maintenance. Think of it like opening a pressure valve on a hot water tank. You're not changing the structure. You're releasing just enough to stop the pressure from waking you up in the middle of the night. Of course, it's not the only factor. Caffeine, alcohol, certain medications, bladder overactivity, and even sleep apnea can play a role. But if you've ruled out those things and you're still waking up twice or more every night, it may be time to consider whether your prostate simply needs to move more, not just grow less. This isn't about desire. It's about physiology and understanding how your body maintains pressure through release might be the key to restoring deeper, uninterrupted sleep. Not every man needs to ejaculate to sleep well, but if you haven't in a long time and your nights are broken, it's worth paying attention to what your body's trying to say. Chronic prostatitis, help or harm? There's one condition that confuses even doctors. It's called chronic prostatitis, or more formally, chronic pelvic pain syndrome. And if you've ever heard those words in a urologist's office, you probably walked out with more questions than answers. Why? Because unlike BPH, chronic prostatitis isn't about size. It's not about cancer. It's about pain, tension, and a kind of inflammation that doesn't always show up on tests, but shows up in your life. Burning, pressure, discomfort after urination or ejaculation, a dull ache deep in the pelvis that just won't quit. So here's the question many men ask, usually in whispers or to Google at 3 a.m. If I have prostatitis, should I stop ejaculating? It feels logical, right? If it hurts, don't use it. But the answer isn't that simple. According to a 2022 publication from the National Institutes of Health, NIH, and corroborated by clinical guidance from the Mayo Clinic, moderate, regular ejaculation can actually help reduce symptoms in many men with chronic pelvic pain. Why? Because stagnation contributes to inflammation. When seminal fluid builds up and isn't cleared, it can irritate the prostate further. Think of it like a car engine that's idling in traffic. The longer it sits, the hotter it gets. Ejaculation in these cases acts like a pressure reset. It doesn't cure the condition, but it may relieve the bloating, the fullness, the congestion that fuels the pain. Now, that's not true for everyone. For some men, ejaculation triggers flare-ups, especially if there's underlying nerve hypersensitivity. That's why the NIH emphasizes a concept called self-regulation through tracking. In other words, you need to observe your own response over time. Do you feel better the next day, or worse? What happens after 3 days without release? What about 7? This isn't one-size-fits-all medicine. It's learning to listen to your own engine. Let me say it clearly, if ejaculation causes pain, that's not a sign of weakness. It's a sign something deeper needs attention, and it deserves medical evaluation, not shame. But if it brings relief, if it loosens the tightness, if it helps you sleep better and feel more at ease in your body, then don't let outdated taboos convince you that healing must look like abstinence. Sometimes motion is medicine, and sometimes the most natural thing in the world is also the most overlooked. Breaking the myths you were taught as a boy, here's a comment I've gotten more than once, and every time I read it, I can't help but smile. My dad used to say, if you touch yourself too much, your spine will curve, you'll go blind, and girls will smell it on you. I believed it until I was 27. First of all, bless our fathers. They were doing the best they could with the worst possible information. But let's call this what it is, generational fear disguised as wisdom. And unfortunately, it stuck. Many men, even today, carry a deep, unspoken shame around masturbation, especially as they get older. They feel like they should have grown out of it. That if they still have the urge, something must be wrong, or if they don't have the urge, they must be broken. Let me say this loud and clear, so every man who ever hid under his blanket with a heartbeat louder than the ceiling fan can finally breathe. Masturbation doesn't make you go blind. It doesn't drain your life force. And it absolutely does not ruin your manhood. According to the American Urological Association, self-stimulation is a normal part of male sexual health across the lifespan. It is not harmful to the prostate, testosterone levels, or fertility, when practiced in moderation and without distress. Let that sink in. Across the lifespan. That means whether you're 16, 60, or 86, your body is still yours to understand, to explore, and yes, to release when needed. The myth that masturbation uses up your testosterone, totally false. Testosterone levels may dip briefly after ejaculation, but return to baseline within hours, according to a 2020 study from the Journal of Sexual Medicine. There is no long-term depletion. In fact, for some men, regular release helps regulate mood, sleep, and even testosterone production by reducing chronic stress. And that whole "it makes you lazy" narrative. Let's be honest, if a man's entire energy bank could be drained by a single release, we wouldn't have survived evolution. What does make men sluggish? Inflammation, poor sleep, hormonal imbalance, low motivation, sedentary lifestyle, not self-exploration. So if you were ever told as a kid that you were dirty or weak or sinful for doing what your biology literally designed you to do, I want you to hear this: that wasn't your shame. It was someone else's fear, passed down, unquestioned, unchallenged, until now. You're not late, you're not Al.